Hi, I'm Casey Pacheco, and I am the community nurse with Preservers of Life. I am coming here to tell you today about healthcare literacy, and I am excited about healthcare literacy. Why? Because as a registered nurse, I am a scientist, meaning that I speak scientific language. You see the names on the bottles, the names of the procedures, the names of the medications. They are all scientific based, meaning the names were created to allow unity, a unification of scientific professionals to understand just exactly what, not just what it is, but what is contained within these medications. However, as a nurse, I am also an advocate and an educator for you. So what I would like to do within our Highlands County community is increase our level of healthcare literacy. What is healthcare literacy? Well, let's talk about literacy. So someone may say, I can read. Yeah, you can read. However, being able to read does not make a person literate. Being literate means not just about sounding words out or even knowing what words are. Being literate means that you also have comprehension or being able to understand not just what the word is, but what they mean. There's a lot of shame and stigma associated with illiteracy, especially healthcare illiteracy. I'll be honest, the words are very hard and very complex. And even people who are very, very well educated have struggled with healthcare illiteracy. That's because it's just not their field. So my job as a nurse, what I intend to do for the community is to open up the field of healthcare literacy and break down not just words, but concepts that the layperson, any layperson can understand, even children. This is a matter of life and death. Removing the shame and stigma associated with healthcare literacy has the power to save a life. You may say, girl, you are exaggerating. Well, let me give you an example. As a nurse discharging a patient who came into the hospital with a hemoglobin A1C, for example, of over 600, right? So I'm giving them, I have treated their diabetes, I have given them their education, and I'm telling them their discharge instructions. And I'm telling them, your hemoglobin A1C is over 600. You cannot do this. You need to make dietary modifications. And here's the paper that tells you exactly how to do it. I have 6 other patients and another one leaving and 2 coming. And I don't have time to explain to this patient everything what I just said. The paper explains. The patient looks at the paper and looks at me. And the patient's eyes, I see, they have no idea what I'm talking about, but I don't have time. So this patient, too ashamed to say, I don't know what hemoglobin A1C is. What are you talking about? They hold their pride and they walk out the hospital. They stop by the local fast food joint and they get all the burgers, the fries, the smoothie, it's all the sugar filled. Week later, patient's back, this time in a diabetic coma. The healthcare literacy can really save lives. What if instead of using my scientific jargon, what if I said, hey, your blood sugar is really, really high. You are eating way too many sweets. And the carbohydrates you take in, the starches, the bread, the cakes, is too much. Your body cannot handle it. You need to watch how much sweets you're having. You need to be careful about how much bread you're eating. Now, That may seem just like a simple switch in language, but that simple switch in language, when that patient leaves, will have them be aware. Now, I'm not saying people choose to do whatever they want to do, but at least they will be aware of what they're taking in. They will have made the connection with their hospital visit and what they just went through with the choices that they're choosing when it comes to eating. I want to do that for the community. I want to do that for you. I want to help you to understand what healthcare really is about. More than just prevention of disease process, I want to help you to understand when you say you want to be healthy, what that means. What does that look for? What does that look for yourself? What does that look like in your community? What does that look like to be healthy? If you want to be healthy, I commend you. This world have us pursue wealth, but health is your wealth. If you are healthy, you will be healthy on every aspect of life. You want to be successful, you could only do so being healthy. I look forward to working with you, and I look forward to sharing more intimate and personal experiences that help you to understand what health looks like. Thank you so much for joining, and I hope to be at your business soon.